This video is for adults who had Kawasaki disease in childhood, whether diagnosed at the time or discovered later. We'll explain how to find out if KD affected your coronary arteries and outline the best ways to manage any resulting damage. That's important because some standard treatments for adult heart disease may be ineffective or even harmful for KD survivors.
If you're watching this video, you or someone you love may be living with a range of long-term outcomes from KD. If you have no symptoms and only recently learned that childhood KD caused coronary damage, remember, this damage has been present your whole life. The only change is your awareness of it, and that knowledge can help you take the correct next steps.
Hello, I'm Dr. Jane Burns, Director of the Kawasaki Disease Research Center at the University of California, San Diego. Kawasaki disease can injure the coronary arteries in childhood and then remain silent for decades. The inflammation from the acute phase of KD can weaken the arterial wall, causing it to balloon out into an aneurysm. Over time, blood clots may form in that aneurysm, or healing can leave scar tissue that can critically narrow the artery. Both can cut off blood flow and cause a heart attack. If you were treated for KD after 2000 and repeated echocardiograms or heart ultrasounds showed no coronary damage, current evidence indicates a low risk of KD-related heart problems later in life. If you had KD before 2000, we recommend a simple, low-cost, low-radiation screening test called a CT calcium score, because the echocardiograms or ultrasound images of the arteries were not very sensitive in previous decades. This test uses the CT scanner to detect calcification or scarring in the coronary arteries. To show why testing matters, consider Lisa's story. Diagnosed with Kawasaki disease at age 3 in 1982, she was followed until age 8 and told she was in the clear. She went on to lead an active life as an avid long-distance runner and never thought more about her KD. At age 37, she developed classic heart attack symptoms that were not taken seriously, and tragically died a week later. Had a coronary CT angiogram been performed during her evaluation in the days before her death, her doctors would have discovered a critical narrowing in her artery that could have been treated, and Lisa might be alive today. If you're otherwise healthy and don't have major risk factors for typical adult heart disease, like smoking or high cholesterol, then your calcium score should be 0 or close to it. This should be reassuring and suggest that your arteries were likely not damaged from KD.
I'm Dr. Jikan Bhatt, and I'm an adult cardiologist at the San Diego Cardiac Center, where we take care of one of the largest groups of adult KD survivors in the world. The diagnosis of Kawasaki disease is often missed in childhood and only recognized later in adulthood. Coronary artery damage from that early illness can remain silent for decades, sometimes first showing up as a high calcium score, chest pain, or even a heart attack from a blood clot in an affected artery. The unique damage to the coronary arteries from KD requires a specialized approach that relies heavily on medications. Standard adult heart disease treatments may be inappropriate for KD-related artery damage and can even be harmful. Optimal treatment may include a blood thinner medication to prevent blood clots and a cholesterol-lowering statin to reduce arterial wall inflammation. As Dr. Burns noted, CT imaging is crucial as it gives valuable information to help make the diagnosis and help guide the treatment. After a diagnosis of KD is confirmed, we typically use a safe, low-cost stress echocardiogram, which is an exercise stress test paired with a heart ultrasound to monitor you. Nuclear stress tests tend to be less helpful and can lead to false positive results. If blood flow looks normal and you have no symptoms, you typically don't need any invasive procedures. Importantly, the usual interventions and surgeries used for atherosclerosis or common adult-type heart disease are often not appropriate or even dangerous for patients with damage from KD. It is also useful to know that when the KD-related damage occurred, your young body adapted and may have developed new collateral vessels to maintain healthy blood flow. These adaptations continued through your adolescence and into adulthood. Thus, even though you may have aneurysms, your body is compensated with these collaterals to maintain sufficient blood flow.
My name is Ryan Turner. I want to share my KD story with you, especially if your Kawasaki disease was also discovered by accident. I'm a 41-year-old with a family, an active lifestyle, and a busy career. Because of a family history of high cholesterol, my primary doctor ordered CT imaging study of my coronary arteries, not once, but twice. Sadly, the cardiologist who read those scans didn't recognize the hallmark signs of KD: large aneurysms in the proximal coronary arteries with clean, healthy vessels beyond. My calcium score, a measure of scarring in the arteries, was unusually high, but that also did not trigger recognition that I had suffered KD in childhood. No medication other than a statin was recommended. Then, while skiing with my family in Utah, I had a heart attack on the slopes. I was rushed to Salt Lake City and taken straight to the cath lab, where they found a complete blockage of my right coronary artery. Thankfully, the damage to my heart muscle was limited by other blood vessels called collaterals that had developed over time to supply blood and oxygen to that area, likely formed in childhood when I suffered the initial damage to my arteries from KD. When I asked my parents if I'd ever had a KD-like illness as a child, they could not recall. That's not unusual. KD can look like a simple fever and rash and can be easily missed. Fortunately, the cardiologist in Salt Lake City immediately recognized the typical damage to the coronary arteries caused by KD. I'm sharing my story to raise awareness about KD coronary damage in adults. If you had KD with some damage as a child, you need care from an adult cardiologist who understands how KD can affect the arteries. You may need blood thinners to protect you from clots and keep you safe. And if, like me, you never knew you had KD and your first sign was a heart attack, make sure your cardiologist knows about the specific recommendations for managing KD-related aneurysms. I'm now on life-saving blood thinners, aspirin, and other medications to support my heart function. Had my earlier cardiologist recognized KD-related aneurysms on my scans, I might have been started on those medications sooner and possibly avoided my heart attack. I now have yearly follow-up with an ECG and a stress echocardiogram, an ultrasound of the heart before and after exercise to make sure my heart is doing well. With careful monitoring and the right medications, I'm optimistic that I can continue to live a full and active life and watch my children grow up.
If KD was part of your childhood and you're seeking adult care, we're here to help. The Kawasaki Disease Research Center and the San Diego Cardiac Center provide consultations for you and your doctor, collaborating with your local cardiologist to guide the best KD-specific treatment for adults.
We want you to know you are not alone.